right, guys, the final one. We're going to talk about our internal and external interpreter procedures. So in this section, we'll cover the procedures for accessing both internal and external interpreters while on telehealth appointments. So internal interpreters, all current policy procedure regarding SURHC interpreters will remain the same. The PCR will notify the interpreting team that there is a need, the language needed, and the time of the session. The interpreter shall present during the session with the provider and assist any behavioral health staff involved in this patient's care. So from check-in to check-out. An option is available for the provider once the telemental health session has initiated to send a doxy.me link to the SURHC's interpreter's interpreter cell phone, and the interpreter may join that doxy.me call in this manner. Just a cool little feature, probably not something that we'll use a lot, but it is there. Ideally, we would love for the on-site interpreters to be in the session with the provider on the camera together having that conversation. External interpreters, we are working on this. This has been more of a challenge than we have anticipated. Some of our current interpreter service, they're on two different signals and they don't talk to each other, so getting them on another call is challenging. So we are investigating this more to figure out how to work it. So my encouragement for you all as providers, office staff, PCRs, whomever, is to really think about, as part of the patient criteria, what languages do we have on site, and do we have to limit to only English and Spanish today, Spanish only on certain days, because that's when our interpreter's here. So be working amongst your team to decide what's going to be the best fit for your department and how you're going to accommodate our patients that have interpreting needs. So guys, that finishes all the procedures. I mean, all of them, all 12. Let me minimize this and get to the top here. I mean, there's quite a bit. If you have any questions about all of these, please send them over. If you have any ideas on how to improve these, or you saw something that's missing, just let me know and we'll get this updated for all of us. I appreciate your patience through this. Get started, let's get some patients seen and expand our service offerings. So take care, have some fun, and let's get out there and help some people.